Conversion disorder is another type of somatoform disorder. A recently married woman presents to the emergency department unable to move her lower extremities. A full workup is done and no abnormalities are found. When further questioned, she reports being beaten by her husband on a regular basis. What's essential of this case is that this is a woman who's complaining of certain symptoms. There is no medical explanation for these symptoms. However, she does have a stressor, and that is what is essential when you have the diagnoses of conversion disorder. This is the patient who experiences one or more neurologic symptoms that cannot be explained. Typically, these are patients who experience a stressor. Once they have the stressor, and the stressor is essential in the diagnoses, you will develop symptoms. And these symptoms, the most common are either one, sensory control, for example, some things like blindness or mutism, or voluntary muscle where paralysis would be the main concern. You're going to find these disorders more frequently in young women. Remember that most of them come from the lower socioeconomic status, and they do have an underlying personality disorder, whether it's dependent, antisocial, passive-aggressive, but many of them do have a personality disorder that precipitates this conversion disorder. What is essential in the diagnoses of these patients is that they have to have the psychological factors, which means that is the stressor causing the conversion disorder. This is the woman that sees something horrible and becomes blind. This is the individual that hears bad news and becomes deaf. This is the person that's going to punch you in the face and their arm becomes paralyzed. Now, typically you're going to have one or more neurological symptoms. You're also going to have mutism, blindness, or paralysis, which, as I said earlier, are the three most common conversion reactions. Sometimes you can have anesthesia, paresthesia, and also abnormal movements as a result of this disorder. What is essential in this type of disorder is that they are associated with four things. Primary gain is what keeps internal conflicts outside of their awareness. The secondary gain are the benefits received from being sick. You also have what is called la belle indifférence, or the beautiful indifference, which means you are truly not concerned about the fact that you're blind, paralyzed, etc. And the last one is modeling, which means you probably know someone who has that similar disorder, so you are basically mimicking or modeling their behavior. And what is important about these patients is they don't hurt themselves. They do not walk into traffic. They do not bump into walls. I mean, their brain has convinced them that they're blind, but their brain is aware of what's happening, so they will not hurt themselves. The treatment, since this is purely psychological, will always be psychotherapy. In certain instances, you can use something which is the amytal interview or the sodium pentobarbital interview, which in movies was described as truth serum. So what this is that you go into a room, they inject you with these medications, and that puts you in a semi-conscious state where your memories can come back and you can become aware of what has happened to you. But ideally, the treatment of choice is individual psychotherapy. As far as differential diagnoses from a neurologic point of view, you want to make sure that these patients don't have tumors, they don't have any underlying cognitive disorders like dementia, they don't have any eye problems like optic neuritis or basal ganglia disorders. From a psychiatric, you want to make sure that they don't have schizophrenia, where they're imagining these things, they don't have mood disorders, anxiety disorders, factitious, or malingering.